Hi everybody, my name is Bobby Tagawa. I'm a physical therapist here in Hawaii. We have a company called Central Oahu Physical Therapy Specialist. While I'm sitting here at home, practicing isolation, containment, one of the most common things that I find myself, my children, my family, is sitting. And what are we doing? We're looking at the news, looking at the news headlines and whatnot, on our electronic devices, on our phones, on our laptops, on our computers, etc., etc. As the day goes on, 1 hour turns into 3, 5, 8 hours sitting in these positions. So sitting for prolonged periods of time, our posture never stays like this. It eventually ends up like this. And as the day goes on and our posture ends up like this, we're at higher risk for various type of neck issues, pinched nerves, tension headaches, tendonitis in our shoulders. And most of us consider tendonitis a result of overuse, repetitive type of activities. But just sitting here, our body is not efficient in this position. When our posture is upright and neutral, we're more efficient. We function better. When we're down here, we have structures that work harder than others. And those structures that work harder than others, they typically get tighter and short and stiff, leading further to this pain and dysfunction, as I mentioned. So the two stretches that we're going to go over are upper trapezius stretch and a pectoralis major stretch. These are two muscles that fall under this whole forward shoulder, forward head positioning. Okay, when they get tight and stiff, again leading to pain and dysfunction. So the first exercise is upper trapezius stretch. All you want to do is put your hand underneath your buttocks, regardless of where you're at, and sitting. Sit up tall the best that you can. Tuck your chin slightly in and tilt your ear to your right shoulder. When you're tilting your ear to your right shoulder, tilt your head slightly forward and you're looking to that left side. Use your right hand to pull your ear down towards your right hip, all the while maintaining your left shoulder back, and just hold this for 20 to 30 seconds. Now, you're just doing a slight pull. So let's say you pulled as hard as humanly possible. Just go maybe 50 to 75% of that. You're not trying to kill yourself here, okay? So after you hit that time frame, you do the other side. And what we're looking at here is, if you're sitting and you take that total time that you're sitting throughout the day, equivalent to 8 hours, you want to be doing this like every 30 minutes, okay? The second stretch, what we're talking about for pectoralis major, these are the muscles in the front of our chest that enlists us, pulling us forward here. So this you just do standing because we want to be as upright as possible. You find maybe a doorway or some area, this is somewhat of a pillar. And all you need to do is you put 1 foot forward. You want your elbows at shoulder level. Now everybody's range of motion in their shoulders are different. If you can't get this high, just bring it lower, okay? The higher you go, the more difficult it'll be. I'm at shoulder level here, okay? My chin is in. My left foot is leading. I'm just leaning forward here. I'm just holding this for 15 seconds, okay? If you notice, my shoulders are over my hips. My body is straight, it's upright. Okay? As opposed to my head forward, I'm sticking my butt all the way forward. My shoulders and my hips are moving together. 15 seconds. Then you switch sides. Chin tucked in, shoulders back, shoulders over our hips, okay? So I'm just leaning slightly forward through my hips and my knees. 15 seconds. Okay? Short and simple way to prevent neck problems, tension headaches, shoulder tendonitis in these confined days. Thank you very much.